we have a 82-year-old male. Yeah, so risk factors of hypertension, hyperlipidemia, and you can see all the other parameters is lipid, hemoglobin A1C, CRP. Actually, CRP is high, 7. Yeah. EF is normal. So known 3-vessel bypass with patent lima and SVG to RPDA. So that SVG to RPDA actually had PCI last time, which was okay. Circumflex, the occluded OM. So that's where we are. So he has a significant disease of the circumflex bifurcation, distal left main to circumflex. Now we can show the angiogram.
Oh, lovely.
Yeah, so you can see the heavy calcium in the distal left main. Prior to then you have OM1 where you can see the bypass that is occluded. So for the last few 3-4 minutes, we are trying to work on the angulated left main. Here you see that.
Yeah.
Not easy to get across. So I tried venture, could not get through. So I have super cross 120 to make that turn into the circumflex. That's where we are. Where I initially was run through them, I am with the fielder wire. So the plan was that even if we get through that, we should try to do some kind of atherectomy, but the way this wire is behaving and look at the circumflex angle. You want to take a picture?
Yeah.
Yeah, there's no way we can do any atherectomy here. Be very difficult wiring, yes. In the branch there, okay.
Pull back.
Now pull back.
You have a microcatheter there, right?
Yeah, she has a venture catheter, I think.
The venture?
This is a 120 Supercross. The venture catheter is a little bit bulky, and it's hard to get it to flex in these kind of environments. For those who haven't had much experience with the Supercross, you want to put a wire down the artery you're going straight through, and put the Supercross to the very past this part you want to go. Pull that wire back, and then come back and have the Supercross hook it.
That little branch.
In other words, the wire doesn't want to. You don't want to have the wire extend out. And sometimes that's not just retraction; it's rotating it so that you're coaxial with the ostium of the angulated side branch.
Venture actually is a better one, but like John LaSala mentioned, since we have disease in the distal left main, manipulation of the venture will be harder. So let me see if I can get this. This catheter, you don't need to deflect. You just have to move it so you can.
Got its own bend on it.
Yeah. Again, I think same branch, right? And I keep going to a small branch.
And for others in the audience, if this didn't work, you would take like a dual lumen catheter and take one wire down the straight portion of the vessel and then come out the side port like you'd be doing a dissection reentry. Only this isn't a
So this is a 190 degree or 120? 120.
120.
So if this
is 120
doesn't work,
Supercross.
then it might be we have to use a double lumen catheter.
Yeah, like a twin pass.
Yeah.
That's what you're saying, yeah.
Yeah.
Enhancer is a new one.
So you're talking about a twin pass? Is that?
What about leaving this wire there and trying a whisper? I know.
Yeah, in the old days, we'd put a balloon down the center portion and take the wire and deflect it off that into the side branch. But now we have a whole series of dual lumen catheters and angulated catheters that we can use.
I'm trying to get the right angle. Okay. Now done. Yes, I'm too distal.
I'm back.
Get there.
Dr. Keeney, what wire are you using going through there?
Now this is fielder.
That's a fielder? Yeah, yes. Sometimes, a hydrophilic wire helps. I use a lot of, still use an old wire like a PT Graphics.
So I think what happens is when I wire, then I enter, I should be actually going into the LED. Instead, I go into this small little ramus.
You may need a wire with more body.
Really challenging anatomy.
Okay, so now. No dye before I remove it.
And sometimes when you do a 2O balloon there, it will change a little bit the angulation and it will make it easier to pass.
No dye. Mhm.
Actually, the plaque in the left main, just prior
Yes.
to the lesion, is preventing.
No, other
this.
thing I could do is, it's calcified. Many times what we do is you dilate the left main,
Yeah.
give more space for this catheter to move.
Yeah.
Yeah.
Get us a high pressure balloon. 3.5, 12.
Yeah, dilating the
When we do
primary
that.
vessel when the side branches and wired, sometimes called a suicide maneuver, but usually it works.
Yeah, or a specialty balloon like an angioscope, it causes less flow limiting dissection and stuff, so it's easier to then manipulate the supercross catheter. I mean, the other thing is, an answer is very good for this actually. It actually, you line it up exactly where you need to. You have support and take a fielder or, you know, some Sheon black or something, and then it goes through that lumen also.
So what I'm going to do is run through into the LED, then we'll dilate the left main, and then try to cross into the.
dilate
We had
maybe-
had the wire across. Our plan was to image and then decide maybe primary IVL here of the distal left main.
Maybe you can
Right
dilate
now.
with a cutting balloon.
Just low pressure
That'll-
dilatation, that's all. Just low pressure dilatation so that you don't cause any dissection.
No, the cutting balloon actually helps.
Yeah, that's the plan, yeah.
Getting lesser chance of dissection and more lumen.
You certainly have your work cut out for you, because not only do you have to get a wire through this angulated portion, but the
Yeah.
irregularities in the marginal are substantial.
Yeah, exactly.
It almost looks like it's crinkled.
Yeah, I saw it.
Three
Yeah, I
five,
mean,
right?
that's the
Now, what,
first thing I
what
saw
do you
when,
have?
with the first angio, yeah.
Get a whisper.
Yeah. Whisper.
Get a whisper.
The problem becomes is also if you get a decent big balloon and you fracture the calcium and calcium goes and shuts the door to the circumflex, it'll be impossible to wire, unfortunately. So these are the risks you have to take. It's a complex case, so these are the steps you follow. So.
Go.
So we always tell our fellows, if you want to come to a course that shows the most difficult complexity and live cases, this is it.
Yeah.
Go. Crack it.
So what, is this a non-compliant balloon or is it a cutting?
Yes.
Non-compliant.
That's non-compliant. We went up to 22 atmospheres now. 3.5.
3.5.
Come back here. Yes. Go up here again.
Sometimes it does
And
the
now we
trick
have the
because it
whisper
changed the
ready.
angulation.
I mean, it's dilating your balloon, so.
Yeah, you're hopeful it'll change the angulation so it's not so severe and give
Okay,
you more
good.
purchase.
Down.
Maybe you did help.
You ready?
Yeah.
Let's take a picture and see.
That looks like it might be more favorable.
Yes. Do you want to try run through whisper fielder?
Still.
You want to change the angle a little bit?
Right, with the fielder.
Yes. No, you're saying now we are changing the wire
Now it will work.
fielder.
Fielder.
And through may also be fine.
This one is fielder wire.
Yeah, the run through also may go, but I have the run
Yeah.
through in the LED. Let's leave it there. We're going to use how is the
LED occluded before?
Whisper.
Okay.
which
You have
one?
a whisper
Whisper.
now?
But fielder has a higher chance of.
What's the wire, Dr. Kinney? Let us know.
Fielder.
Now whisper. Srinivas Duri wants me to use
Cyan
whisper.
blue would be a
Yeah,
good
that's
Good to
choice.
listen to him.
He still likes that whisper 20 years later.
Exactly.
Still a good wire.
Yep.
Yeah, I think you have to, this is where you just kind of
Yeah.
up the game to a more high performance wire. Sheon black, whisper wire.
I was actually thinking like,
like,
a Gaia or
uh,
something. They're
Gaia wire.
almost-
Okay, let us see how whisper will behave now.
That's rugged. I still use a PT
calcium
Graphics.
though? Pilot right now, right?
See what that is?
Are we there?
I think you're in that little
Yeah, it is.
ramus branch.
Has a
There
high
you go.
chance.
Yes.
You may still need the Supercross.
Supercross?
You may still need it.
Okay. Now Supercross or we go to venture now? That venture we had.
You can do venture.
I think there's a hidden component here that we're missing.
Yes. I don't know. There's hidden car. It could be so much.
Be a
calcium.
shelf there.
You could see it in a different view. Yeah, maybe more.
There's some kind of a shelf there or
There's
something.
something blocking the way.
Yeah.
Here.
Really?
So this is a poor man's IVUS, I call. You see that?
That's it.
Hitchcock's window, bring all the shutters in and do a cine.
Yeah, this is it. So instead of just coming out laterally, it seems to go superiorly and then comes out, then goes lateral.
And then come back out. Yes.
I would use this and use, if you can't get it right away, go right to the Supercross and point it upward.
No, that's what Supercross or I think let's go with the venture because
Yeah,
it's over the
and
wire.
then you probably will have to change it.
monorail.
If you feel that didn't go, I would probably do Xion Black or something, to try to get, or Fielder XTR to try to get into the lumen, because the calcium will stop you from going there with this whisper and the other balloon wires.
The question. You have the Fielder FC?
Reserves.
There's a neuro wire I used to use when we didn't have all these things. It's called Synchro 2. And that actually has a very long radio. Equation is 014, and it goes in the brain, but it negotiates tortuosities better than any wire I've seen. So we still have it, and John knows we still have in the lab, and there are some cases that are virtually impossible, so sometimes we use that.
Get us a regular Fielder.
Yeah, their wire of last resort, though, Jazz, is what? It's a neural wire.
Yeah. But I think with
I'm
either
now going
FC,
back with the Fielder.
yeah, either FC or Xion Black, I think with the Supercross will probably do it now because you have more room to play with it.
On my ear.
If I have to do Supercross, I have to do it now because reintroducing Supercross is not easy either. Again,
Can't hear anything.
you have it
Can't hear anything.
connected.
Yeah.
Press it. Maybe.
This one is the venture. Here.
I wonder if you would have done IVUS or the LAD, you would have seen exactly the entry.
Let's see where that is.
No, some die.
Yeah.
I
That little
think it's the same
ramus.
little branch.
That's that little ring.
no.
Oh, maybe not.
Looks good.
No, it looks like you're in the right.
It's going up to an atrial branch.
It's going the atrial branch.
But
Yes.
it's almost there, AK.
You're in the area.
I know, but A does not make that little
That little
flickering
turn
turn.
up and you'll be in.
The navigator from the podium.
You know what I'm going to do?
Keep this wire and then.
No.
But you can get there maybe a fine cross and then
Yeah.
flip the wire.
Advance the microcatheter.
Okay, get the
Fiber.
venture.
Let them start the debate from the side.
That's it. No. They want the crossing to the circ. Once that is done, then they can go. Yeah. That's it. So what we are going to do is go with the venture into that circumflex and then see if we can deflect it. This is just going into the circumflex. We actually have to get into the OM.
Yeah.
Can you use this mic, Sharma? Yeah.
Which wire is this?
This is the venture. Sorry, this is the
So
fielder.
listen,
No.
Dr. Kinney, we have, is there any way, because we're already a little bit into our talk, is it
Okay,
possible
okay,
that we
good.
put you in the side and watch and go to
Yes,
our
yes.
talks?
Okay,
to
hold
our-
on. Let me just cross here. and
Okay.
then-
That's it, the last. If the cross, otherwise we'll continue to do it. Yeah, it will take a little time. I just will show that picture of the LED. It looks like we call it a LED had been transplanted.
Okay, SF, you got enough of your time now. Yeah.
There you go. I mean,
No, it has to
you're
make that
almost
turn.
there,
Hold on.
AK. But I'm thinking that
I think we're getting
Okay,
full.
fine.
we let
Go.
you play in peace.
Go,
We watch you on
yeah,
the side.
go.
We do our debate. We come right back to you, okay? Is that
Yes,
okay?
but don't go to room 2.
No, we're not going to room 2. We are not leaving you. Okay, great. Oh, man, you
where were
got
we?
to cross somewhere.
That's,
Yes.
how did
So
it
we
got
did
with
that.
Dr. Sharma's advice?
So we ballooned it again, and then we were able to get the wire through this time.
What
Change it
what
to
wire
rotor
got
wire.
through? Can you tell us how you got that
It's
wire?
a filter again. Yeah.
Okay, good. And
Then we had to see the fine cross would not see this area at the proximal part of the ostial OM.
Yeah.
After that, the fine cross would not go further down. So we left the fine cross, and then you free wire with the rotor wire.
Yeah.
Yeah. And then if you see here, 1.25 bar.
yeah,
1.25 bar, and would not do it. Then we went the high speed to 160,000 RPM,
Have it here.
and this is where we got it.
Camera.
I think you see
All
it,
the other
right?
guy. You can just show the camera.
Yeah. So if you go there, you see it?
yes,
No.
we see it. Beautiful.
Yeah, we were able to get way further down. Yes.
Okay.
And then we ballooned it. Now we have put a 3048, and the IVUS, we can show this is a high pressure balloon 3.5 in the left main, and Kiski is showing us the IVUS.
Wow.
Go back to the
Wow.
IVUS now. Yes. So if you see, one question was that you have the circ. You see that? The major circ.
Yeah, yes.
I did not wire it. We just left it the way it is, and it looks, the flow is still good.
Okay, show us. I mean, it looks angiographically, it looks good. If IVUS looks good, then we're amazed that you got this done.
Yeah.
Show us.
And shows the proximal left main area is good.
Very good.
Yeah.
Yeah. Maybe a little bit more expansion there, but
Yeah, 10. Yes. No, that was post and SE is 10. Okay.
They'll bring the camera.
Yes. Looks good there.
looks
I
great.
guess we are done with the case. So
Wow, congratulations.
point was,
Unbelievable work. Unbelievable work. And right on time.